Welcome to the Explainer. So today we're unpacking a massive and honestly a desperately needed shift in how healthcare operates in Pakistan. If you've ever had to navigate the medical system there, or frankly in a lot of parts of the developing world, you know exactly what I mean. It can be a deeply frustrating, totally draining experience. But today we're looking at a platform called Xdoc, and let me tell you, it's completely changing the game. We're talking about a real digital revolution here.
Let me ask you something to start us off. Have you ever dragged yourself all the way to a hospital, already feeling absolutely terrible, only to find yourself stuck, waiting, 3, maybe 5 hours in this crowded, totally unpredictable queue? And all of that just to get a little paper token, right? It's a harsh reality for millions of people every single day. The physical toll of just sitting there in a chaotic waiting room when literally all you want to do is go home and rest. It's just immense.
Okay, let's dive into this analog waiting game because it's just packed with these deeply frustrating pain points. First off, there's absolutely no advanced token booking. You might travel all the way across the city, battling heavy traffic, only to get there and find out, surprise, your doctor is actually on leave today. Then come the hidden costs. You usually only find out what the consultation fee is when you finally make it to the front counter. Add in this widespread confusion about, which facilities offer free government care versus paid private care, and hospitals that are still relying on these massive manual paper registers that can so easily misplace your critical data. And, well, you've got a system that is literally begging for an upgrade. And this is exactly the massive problem Xdoc is stepping in to solve. You'll recognize it by that really clean blue stethoscope heart logo. So what is it? Xdoc is Pakistan's very first complete digital healthcare marketplace. Think of it almost like a major e-commerce platform, kind of like a Draws.pk, but exclusively built for healthcare. It acts as the seamless two-sided digital bridge. On one side, hospitals and clinics can open up their digital storefronts, basically. And on the other side, patients can just log on, find their doctors, check the fees up front, and book their visits without any of the usual hassle.
The entire core promise of the platform is captured perfectly in its tagline, Apno Doctor Tunde Ghar Baate, which essentially translates to find your doctor from home. It's built specifically for the local context, complete with full bilingual support, and it entirely shifts the power back into the patient's hands. It's letting people manage their health right from the comfort of their own couch. A total game changer.
Moving right into Section 1, Seamless Journey for Patients. We're talking about eradicating the waiting room forever.
So, looking at it from the patient's perspective, this digital journey is incredibly straightforward. It's basically 3 steps. Step 1, you just search for hospitals or doctors, and you can filter this by city, by specialization, and, this is a big one, by transparent fees so you know what you're paying up front. Step 2, you book your token and pick your exact time slot. And finally, Step 3, you track your queue position live straight from home. There is absolutely no more guessing about when you're actually going to be seen. So the crucial point here, the real engine driving all of this, is what they call the smart token system. When you book that token online, it's confirmed instantly and it updates the hospital's dashboard in real time. Because you can actually see your live queue position on your phone, you only leave your house when your turn is coming up. You literally bypass the physical waiting area entirely. And let's be honest, that means you're also bypassing all the coughing, contagious patients sitting in it. Now let's look at the other side in Section 2, Smart Tools for Hospitals. This is all about moving from paper to 100% digital operations. Behind the scenes, the contrast is just stark. I mean, in the old analog way, hospitals were relying on these completely error-prone paper registers, manual staff attendants, and literally counting the daily revenue by hand. Can you imagine? But with this new digital setup, facility owners get a powerful, centralized hospital management dashboard. They can manage their staff, monitor their revenue in real time, and, get this, they can export all their daily data to Excel with just a single click. It completely cures that massive operational headache. Of course, the hospital front desk staff need some seriously robust tools to handle that crazy daily rush, too. Enter reception mode. This is a specialized, full-screen interface designed specifically for the front desk. It clearly shows the exact token currently being served, plus all the upcoming patients. And with one-click status updates and this brilliant automatic no-show detection, which, by the way, instantly skips patients who aren't there so the line keeps moving, it allows the receptionist to effortlessly manage this massive daily flow. No more chaotic, congested lobbies. And here is where you really see how seamlessly Xdoc integrates into people's daily habits. WhatsApp integration. Every single time a token is booked, an automatic notification gets sent directly to the patient's phone. It's got the doctor's name, the appointment time, directions, the whole shebang. But even better, Let's say a patient just walks into the hospital without the app. The receptionist simply issues a walk-in token and texts them a live tracking WhatsApp link. That means even walk-in patients don't have to stand around. They can literally go grab a chai nearby and just track their turn right on their phone. All right, moving to our final section, Section 3, a digital healthcare future. Bringing all of Pakistan's healthcare into one centralized directory. Zooming out a bit, Xdoc essentially acts as this massive nationwide directory, and it clearly separates facilities to make sure healthcare is transparently accessible to literally all income levels. For example, under government hospitals like JMPC in Karachi or Mayo Hospital in Lahore, Xdoc prominently displays a free OPD badge, so patients know right away that outpatient care won't cost them a single rupee. On the flip side, private hospitals, places like Aga Khan or Shifa International, well, they're listed with entirely transparent paid fees. There's no more arriving at a hospital and getting hit with a massive surprise bill that you simply can't budget for.
Which brings us to this really powerful idea. Pakistan ki healthcare ab digital hogi. Pakistan's healthcare will now be digital with Xdoc. Whether you're a patient who just wants to find a doctor in seconds or a hospital owner ready to finally modernize your clinic, this platform is the bridge. I'd highly encourage you to go visit xdoc.pages.dev to see it in action for yourself. And I want to leave you with this final thought. When millions of people no longer have to waste 3 to 5 hours in a physical hospital queue just to get a piece of paper, what are they going to do with all that reclaimed time, health, and energy? Really, how fast will a nation transform when its entire healthcare system fits seamlessly into the palm of its citizens' hands? Thank you so much for joining me for this explainer. Keep learning, and I'll catch you next time.